Okay, we're going to manually ventilate a patient with an Ambu bag and using a oral pharyngeal airway. So I got a report that I need to go ahead and go into the patient's room and they need some assistance with manual ventilation. I gathered some supplies. I grabbed an Ambu bag and some different sizes of oral pharyngeal airways. I'll go ahead, enter the patient's room, wash my hands. The patient is not responsive, so I went ahead and I'm going to go ahead and measure to make sure I have the right size for her. You want the flange at the mouth and then the end of this at the tip of her ear. This looks like a better size. This one would have been too small for her to keep that airway open. So what I'm going to go ahead and do is insert the oropharyngeal airway, and with that I'll go ahead and do a chin tilt and place it by tucking the tongue, go halfway and insert and twist, making sure that goes all the way down in the airway, keeping it open. Now I'm going to go ahead and hook up my Ambu bag to the wall, get the head of the bed so I can go ahead and keep that chin tilt up and get a nice secure seal around the patient's mouth. I'm looking for chest rises and bag refill time. So I'm going to go ahead and start ventilating this patient. You can see her blankets rise there a little bit, so we're getting some chest expansion, which is great. You can readjust if you need to here. That's a better seal. You don't hear as much air coming out the sides. And I'll be watching the clock, making sure I'm ventilating my patient in between 12 and 20 breaths per minute, allowing the bag to refill all the way as well. So I'll go ahead and show you what that'll look like. That's a rate of about 20 breaths per minute. I would continue doing this until the doctor, the nurse, whoever who's in charge in the room decides that we're going to go ahead and either put an artificial airway in, or if the patient starts breathing on her own.